We bring in our friend, Dr. Nicole Saphier, part of the Clay and Buck Podcast Network. You can also see her regularly on Fox News. She does fantastic work across the media spectrum. And Dr. Saphier, we will start with the fireworks that have just come as as Robert Kennedy was testifying in front of many different senators out there about what exactly is going on as it pertains to rules on COVID shots and rules on vaccines in general and science and everything else. What did you take away from that testimony, and how would you assess what is going on right now from a health care perspective?
Hey, guys. Thanks so much for having me on. Yeah, I'll tell you, I tried to live stream as much as that Senate Finance Committee with RFK Jr. as I could. I'm in the hospital myself, so in between patients. But, there were a lot of fireworks. There were name calling, there were yelling, there was eye rolling. I mean, people were frustrated. But here's what I find as a layperson, but also someone in the medical community, what I find frustrating watching here. This was all about people just trying to get talking points out for media headlines. This was not a conversation. This is not for the greater good of America, what happens in these committee hearings. And that is what I find the most frustrating. I think RFK Jr., Secretary Kennedy, I thought he had made some really strong points. I think some of the senators made some really strong points. And ultimately, I think that there was more arguing of semantics than anything at all. And unfortunately for me, looking at this from the outside in, throughout all of COVID, we became a very fractured society. And all of a sudden, we have weaponized public health. We have politicized it. And all I'm looking for is, what are we going to do to bring the country together to try and get politics out of public health, out of our healthcare system as best we can? I mean, you never will be able to completely, but the best we can. And how are we going to unify the nation? And unfortunately, watching some of this tells me that we are nowhere closer to unifying the nation as we were 4 years ago.
Well, I want to have you react here to an exchange, Dr. Saphier, between RFK Jr. and Senator Wyden. It's about 40 seconds long. This is cut 18. Hit it.
I don't see any evidence that you have any regrets about anything you've done or plans to change it. And my last comment is, I hope that you will tell the American people how many preventable child deaths are an acceptable sacrifice for enacting an agenda that I think is fundamentally cruel and defies common sense.
Senator, you've sat in that chair for how long? 20, 25 years, while the chronic disease in our children went up to 76%. And you said nothing. You never asked the question why it's happening. Why is this happening? Today, for the first time in 20 years, we learned that infant mortality has increased in our country. It's not because I came in here. It's because of what happened during the Biden administration that we're going to end.
How much, Dr. Saphier, of the apparent animosity that these Democrat senators show toward RFK Jr. is because he's RFK Jr. and they don't like what he has stood for in the past, or just because he happens to be Trump's HHS guy?
Yeah, so that's a great question. And first of all, that was one of RFK Jr.'s strongest messages, in my opinion, during that hearing, was everybody was criticizing him. And he's like, it turned to crap under you guys. You've been in office for decades sitting on this committee. And this is the first time we're having these conversations about making people healthier again. So I thought that was rather cheeky, but also very poignant. Senator Wyden came out saying that he is going to be releasing a report today. He asked to put it into evidence that supposedly will show the damage to health care of the American people done under RFK Jr., highlighting chaos, corruption, and higher health care costs. And yet he said these things, but we did not see that report or the data. So again, Wyden, I thought, was trying to get some of those talking points. At the end of the day, and this is something I've said now, for the last several weeks that I get some criticism on, is that we already know Trump derangement syndrome is real. I mean, one of these days it'll be a diagnosable condition that as a medical doctor I can code it and it'll be a true diagnosis. But the RFK derangement syndrome is real as well. And so for me, maybe he is not the perfect messenger to be out in front of the camera talking about the work that they're doing behind the scenes. He is bringing a ton of insight and a ton of innovation and a whole new thought process to the HHS. They're finally starting to look at root causes of chronic illness. They're trying to make a systems more efficient. These are all great things, but the moment he steps in front of the camera or gets behind the microphone, half of the country is turning it off, just like they always do with President Trump. And so when it comes to public health, it would be great for me if there was another spokesperson who actually came out to deliver that message, because as you see, if you look at social media right now, people are just making fun of Secretary Kennedy. They're making fun of the fact that he was breathing heavily into the microphone. Forget the fact that he has a neurological condition, and what they're doing actually is grossly inappropriate by making fun of someone, but they don't like him, and that's the bottom line.
Dr. Saphier, I think the biggest issue that we face as a country as it pertains to public health is, in the wake of COVID, many people, myself included, have lost all faith in public health so-called experts to give us the best possible advice. What would your advice be to try to cure what I believe is the biggest issue in America today, which is just lack of trust in the wake of what happened with COVID?
I mean, that's a very complicated question, and there's not going to be a one-size-fits-all answer to that. But part of that is going to be getting people that are well-respected on both sides of the aisle into the HHS, into the CDC. We undermine trust when we like right now, what we're dealing with right now, and you're looking at the conversation is surrounding vaccines. The CDC, we're seeing the fallout from what happened, because not only are parents questioning the COVID vaccines because the CDC doubled down on the mandates long after science changed, the reality is now parents are questioning all vaccines and just really questioning public health in general. And so we have to take a big step back. And what was settled science for the last several decades, if people truly believe that it's still settled science and the data is there to support it, then you need to show the data. Because just saying, well, this is what's the right thing to do, that doesn't work anymore. We can't have that paternalistic attitude when we're talking to the American people, because the American people are educated. They want to make informed decisions. And when you have this digital era where all of a sudden they're realizing that the truth is at their fingertips and it's not necessarily just from the mouthpieces that they're seeing from the CDC or whatnot, you have to make sure that you are being very nuanced in the recommendations for public health. Part of that is going to be, right now, RFK Jr. is having to put together the Vaccine Advisory Committee. He got rid of all the original members because he said that they were essentially all part of, the industry standard, and it was time for them to go. And while I may not disagree with a lot of them needing to go, he's kind of swinging that pendulum far the other way by putting all new members on that are part of his inner circle and his inner thinking. We have to make sure that we have full dialogue and debate on these committees. So we can't just go from one inner circle to the next. We need to start building these institutions that are with people who are going to last much longer than just an administration.
Are there just way too many vaccines, Dr. Saphier, in your opinion, in the suggested schedule for children? I think the number, we had Dr. McCary on, and he said it was something like 70 or something along those lines over the course of, now I know that some of those are multiple shots and they're given over years. That just seems like a lot of shots.
Sure. So in my humble opinion, I think that we need to look at the recommended childhood vaccine schedule. What's happening in Florida, where they're just trying to do away with all vaccine mandates, that's a completely different conversation. What I'm talking about is not necessarily implementing mandates or recalling getting rid of the mandates. I'm like, let's reevaluate what we're even recommending. Can we change the timeline? Does every single child need all of these vaccines? Because the reality is not all vaccines are created equal. Lumping them together just completely erases the science. The MMR vaccine, the one with measles, that provides decades of protection, while the pertussis one, that immunity wanes within months. And the public health messaging has to acknowledge the differences, because we're undermining trust when we pretend that every vaccine works the same. And Americans truly deserve nuance. I think we can change the vaccine schedule. We could actually decrease the amount of vaccines children get without risking the safety of the individual child or the community. But it just means you have to open up that conversation, and you have to be willing to have that conversation, because unfortunately you have a lot of people who have their head in the sand right now with that vacuum thought mentality of, well, if you start changing it now, you're going to change the whole thing, and that's going to creep in vaccine hesitancy. But if you don't acknowledge the people's concerns and you don't acknowledge all vaccines aren't created equal, you're actually promoting vaccine hesitancy more than anyone else.
How can people find your podcast and dive in if they haven't already, Dr. Saphier?
Well, thanks to you guys. Wellness Unmasked with Dr. Nicole Saphier is part of the Clay and Buck family. We have a weekly rundown every Friday at 10 a.m. with about just 5 minutes of me telling you what happened that week. We're going to go all through the hearing tomorrow. And then on Tuesdays, dropping at 10, Wellness Unmasked, you have a longer full episode. Next week, you'll hear me with Jennifer Gallardi. She's the Senior Policy Analyst for Restoring American Wellness at the Heritage Foundation. We talk all things Make America Healthy Again. We get into a little bit of a healthy debate on some things, and I'll tell you, it's a great interview, so please make sure to catch it out. I'm also on X, Instagram, and Fox News.
I gave you all that, but I meant to ask you this as well. So I encourage you to go follow Dr. Saphier.
The Clay and Buck Podcast Network, Wellness Unmasked, Dr. Saphier.
Tremendous collection of talent there. What's the worst date you've ever been on, Doctor? Because Buck brought up The English Patient. I realized that I went on a high school date to watch that movie, which was not a great movie to go on as a high schooler. We just had Katie Miller on. Do you recall the worst date that you've ever been on in your life? Is there one that stands out?
I think the worst date I've ever been on in my life was my first kind of date, or not even a date, but when I met my husband, because we actually met in a wine bar during a medical conference, but I was drinking hot tea, and this guy comes up to me, and he's thinking that my tea is spiked, and the whole time he just cannot believe that I'm just drinking herbal tea while sitting in a wine bar, and it was very awkward and very uncomfortable, and 20 years later, we're married with kids.
Wait, how did he make the transition? Like, how did he go from like, hey, like I think something's been spiked in your tea to, I'd like your phone number.
Oh, he was asking for my phone number the whole time. It took about 2 years for us to actually go on a date, but the man was persistent, and I'll tell you, persistence pays off.
I had a very wise man tell me for many years, persistence is the key in all things. So there you go. Dr. Saphier, thank you so much. Guys, go check out Wellness Unmasked on the Clay and Buck Podcast Network. When you switch your cell phone to PureTalk, you're saving money every month without sacrificing quality, because PureTalk operates on America's most dependable 5G network. They use the same towers and network as the big wireless companies, but don't have the same overpriced costs, so they're able to pass on the savings to you. The PureTalk price point, get this, $25 a month for unlimited talk, text, and plenty of data. Compare that to your current monthly cell phone bill and calculate the savings. You could save $600 or more every year, and with a family plan, more than $1,000 a year. And with PureTalk's customer service team, which is based in the U.S., you can switch hassle-free in as little as 10 minutes. You can also keep your phone and number, so nothing changes except the reduced size of your bill. Using your cell phone, dial pound 250 and say the keywords Clay and Buck to make the switch. You'll save an additional 50% off your first month. Again, dial pound 250, say Clay and Buck to start saving today. Pure Talk, wireless by Americans for Americans.